It's time for Mental Health Monday with Dr. Christine Caulfield of LSF Health Systems, and today we're talking about National Suicide Prevention Month, which is this month. Doctor, thank you so very much for joining us again.
Pleasure to be here.
The pleasure is all ours, I promise you. So what does recent CDC data reveal about the current suicide rates in the United States and here in our area?
Yes, well, it's pretty bleak, David. We have the highest rate since the inception of tracking suicides in our nation right now. And here in Duval, a 15% increase from 2021 to 2022. 2022 is our latest stats we have, so very disturbing.
Yeah, that's a huge increase.
It really is, and it translates to one person every other day here in Duval dying by suicide.
That is terrible news.
Yes, it is.
All right, so who's the most affected?
Well, males age 65 and older, as well as adults 45 to 64. Those two cohorts are the most prevalent to die by suicide, even more prevalent than our younger populations.
Right, which stereotypically you would think would affects more of the younger folks, right?
Exactly.
So what's going on with folks 65 and older?
Well, I think there's a combination of a lot of things. First of all, retirement plays into this scenario, especially 65 and older.
So loss of things to do, loss of
loss of identity,
right.
Increased drinking and or drug use. Usually completed suicides have some form of alcohol or other drug as a deadly duo. Also, there's a proliferation of increased guns in our country, and so males typically utilize more lethal forms such as firearms. So I think there's a lot of different factors playing into this statistic.
Yeah, it sounds like there really is quite a bit going on. So earlier this month was the first ever, 988 day, right, on September 8th. So tell me about the significance of this special day.
Yes, it's very special, 988 day. Yeah. 988 is the 3-digit number that anyone can call day or night if you're feeling like you want to harm yourself or you take your own life. So it's a lifeline. Somebody is going to be on the other end of that phone to help you gather information about you and connect you to resources in the community.
Because there are plenty of resources, right? Like you just have to reach out and seek them, right?
Correct.
Okay, so what should someone do if they, suspect someone they know is feeling suicidal?
Yes, well, it's very important that you ask the question. A lot of people think that if I even mention the word suicide, it might propel them to move forward.
Sure.
Nothing could be farther from the truth. You need to ask the question. I'm worried about you. I've noticed some changes. I'm concerned. Are you thinking of taking your own life? And then listen non-judgmentally. It opens up that person to feel safe, to feel seen and heard, and then you are going to be there to help them, support them, and connect them to resources that will help and stay with them. You also want to keep them safe. If you are aware that they have firearms or any other means that they may be thinking about utilizing to take their own life, you want to remove those.
Absolutely.
You need to keep them safe, and you need to plug them in immediately for additional help.
Dr. Caulfield, where can we send folks for more information?
Yes, you can call our Access to Care line at LSF Health Systems, which is 1-877-229-9098. We will plug you into all the community resources in this area. 988, don't forget that 3-digit number. If you're concerned for you or your loved ones, pick that phone up and call. If there's immediate danger, call 911. Resources will come. Our law enforcement are trained and can help with the situation.
I really do appreciate it, Dr. Caulfield. Thank you very much, guys. We'll be right back.
Pleasure.